Pastors Chooks and Toyin Ogoye. Pastors Chooks and Toyin Ogoye are the lead pastors of Resurrection Life Church, Johannesburg, South Africa. They are passionate about building families and raising men and women who transform and uplift the standard of life in their communities through understanding and applying biblical principles. Pastor Chooks and Pastor Toyin frequently host workshops, seminars, and conferences for transformation. Some of their programs include Kingdom Financiers Conferences, Dream Achievers Conferences, Marriage Enrichment Courses and Seminars, for wives-only seminars, Single Ladies Boot Camps, and Limitless Men Seminars. They are the founders of the Power of Women Academy, a group mentorship for high-impact women, and host the annual Power of Women conferences and amazing Power of Women broadcasts. For more information, please visit www.idelight.co.za and www.reslife.org.za or WhatsApp +27 814 210 835.
Good evening. Welcome to another edition of the Amazing Power of Women broadcast. It's Thursday evening, and we are here for another session of the Amazing Power of Women broadcast. And today is the last Thursday of the month. And what that means is it's our Ask Your Gynae session on the Amazing Power of Women. My name is Toyin Ogoye, and with me is Chucks Ogoye. And he is the author of the book, The Amazing Power of Women, that informs this whole broadcast and has really brought about so many things. And we're so glad that for the things that have continually come out from the revelation from the book. And what we say is that this whole program speaks to three aspects of a woman's life: her spirit, her soul, and her body. So we will do things that will speak specifically to her body, which is why we have the Ask Your Gynae, so that the specialists around that can tell us about our body and how best to take care of it. What are the things we should look out for, and what are the things we don't need to worry about too much because it's common. So those are the things that we tackle, and we just get to know a bit more about our bodies on the Ask Your Gynae. Once a month, every last Thursday of the month, we have your Ask Your Gynae. And we also have things that have to do with the soul, how to live as a wife, how to be as a single woman, different things, your career. We speak to all those aspects of a woman's life. And so, over to you, Pastor Chooks.
Well, tonight I'm excited. We have our resident gynecologist on hand, stand by to take over and take us through the things that we need to learn today. Today's topic is quite interesting.
Yes.
All right. The topic is genital infections and abnormal discharges.
Yeah.
All right. And our gynecologist, Dr. Audrey Gugu Gamedze, is going to be shedding light and teaching women what they need to know on the subject. All right. We are going to welcome Dr. Gamedze shortly, and then she will take over, and then we will come back to round up for tonight. God bless you, Dr. Gamedze. Over to you.
Dr. Audrey Gugu Gamedze. Dr. Audrey Gugu Gamedze is a medical doctor by profession, a specialist consultant in obstetrics and gynecology. She runs her own private practice where she helps and serves women from all walks of life on a daily basis. She has a heart for women because she identifies, by virtue of being a woman, a sister, a mother, a wife, a daughter-in-law, and understands the journey of a woman, and is still passionate about wanting to learn more about women. She is a born-again Christian medical practitioner. She sees her medical practice as a powerful ministry platform, an opportunity to touch and transform the lives of women and their families to the glory of God. Dr. Gamedze features monthly on our Ask Your Gynae show at the Amazing Power of Women broadcast, where she helps women understand the female body and how to care for it. She's the mother of 2 children and has been married for over 22 years.
A very good evening to our dear listeners and viewers again. Welcome to the powerful session of the Ask Your Gynae in the Amazing Power of Woman. A special word of gratitude to my host, Pastors Toyin and Pastor Chooks. I'm so grateful for the opportunity, as always, to be part of this power-packed session. Today, we are going to be tackling another interesting session of vaginal discharges. It is a natural phenomena for women to experience varying degrees of vaginal discharges in the course of their life. So we want to see what is the purpose of the vaginal discharge, what is it, what is normal about it, what is an abnormal vaginal discharge, and when should you be concerned? What are the pointers that something is not going right? And what are the common abnormalities that we experience in the vaginal discharge? And what can be done about it? If you get to the doctor, what should you expect? And I then wait to hear from you after we have finished our sessions. Okay, so what is a vaginal discharge? If we were to unpack, it is a fluid secretion that is from the glands of the cervix. Cervix is the mouth of the womb, which is found right at the end of the vagina. And it can also be secreted by the walls of the vagina and also by the glands that surround the vaginal external opening. So the woman is somebody who has a lot of types of walls that can secrete different consistencies of fluids, which at the end of the day or at the end of the process can be of a consistency that can define the physiological state of the woman, that can define the menstrual state of the woman. So what is the main function of a vaginal discharge? Is it to cause a nuisance so that we pay a lot for panty liners? Is it to cause a panic? Why is it there? It is mainly for housekeeping. I'll use that word. It's mainly there for housekeeping. Its acidity must be at a balanced state such that it can be able to flush out the old cells of the vagina wall and also the dead bacterial cells. With the acidity, it allows a balanced ground for the growth of the germs, which can be bacteria or fungus. Those are important in keeping the environment of the vagina in an antibiotic state. That means that it can be able to kill and destroy harmful germs that are coming to cause disease conditions. So, what is a normal vaginal discharge? It should be, number one, of white color. The color can be milky or a lighter part of the milky color, but it's usually white in color. If you look at it on the panty liner, it can look off-white depending on how long it has been on that panty liner. Number two, it must not be offensive. That is, it must not have a pungent smell. So the normal smell, I would say, it's that of a plain yogurt or amasi, because the vagina contains mostly lactobacillus, which is the kind of germs that is used naturally to convert milk to sour milk. So that will be the kind of a smell. Number three, it must be of smooth, non-granulated, non-frothy consistency. So it's usually a smooth white. In some cases, it may be a little bit on the sticky side or a little bit on the watery side, but it must be of a consistent consistency. So there are varieties of normal depending on what is the daily vaginal discharge that you see. So usually we start seeing the vaginal discharge around puberty. So if you are observant enough, you'll start looking at the color, you'll start looking at the consistency, and you'll start observing the odor or the smell of the vaginal discharge. And then anything different from what you are used to may be a cause for concern. Cause for concern may be that you would want to discuss with other women, although that reference is usually very subjective, or you can discuss with your general practitioner about your concerns around the vaginal discharge. There are varieties of normal. That means that no two women may have the same type of vaginal discharge. So that discharge can vary according to age. Why am I mentioning age? Age is mainly the factor that will influence the levels of your estrogen. So vaginal discharge is influenced by your hormonal state. So estrogen plays a huge role in that. So pre-puberty, the vaginal discharge can be on the scantier side, and it can be much more thinner, or it can be more on the copious side that is a lot more frequent and a lot more heavier. And then pre-pubertal, the babies are the common people where you would see a vaginal discharge. Let me make an example. You deliver a baby today, 2-3 days down the line, up until around 12 days or 2 weeks, you start seeing the vaginal discharge on this little girl. It's very common with girls. It can be a cause for concern, yet that is a normal phenomena in female babies, because those babies, after being born, they carry out sort of the estrogen environment of the mother. So that is why they'll have a vaginal discharge. But as the estrogen levels go down to that of a baby status out of the woman's womb, then the vaginal discharge will stop. So it is not something that you should worry about. When you see it, it will be concerning, my baby has a discharge, but it is a normal phenomena pre-pubertal. Then yes, in puberty, as I have explained earlier, and then in the reproductive stage as well, there will be a vaginal discharge. In the menopausal state, because your estrogen levels are going down, now it changes in consistency. So a menopausal woman is very common that she will complain that her discharge is offensive. The reason why the odor changes is because now the less levels of estrogen mean that she doesn't have that much of a discharge, and then she doesn't flush out the dead vaginal germs and bacteria as she would often do, and that may cause a difference in the smell. Also, with the thinning of the vaginal walls, that can result in the vagina irritating the walls or the vulva. So they are much more prone to recurrent vaginal infection, much more prone to recurrent bladder infections. So I have said that there are normal varieties, but within certain age restrictions. Then the second physiological state where you can find that there is a variation from what is a normal discharge will be in the menstrual cycle. The first part of the menstrual cycle, you can get a brownish discharge, and then and also in the last part of the menstrual cycle, the discharge will be brownish. And then when you get into the next phase of the cycle, you find that the discharge is no longer brownish, but it is white, and then it becomes very thin to a transparent color and a little bit more watery, a little bit more copious, and then after that it goes back to white. So you need to know that at a certain level of your menstrual cycle as a woman, you may have differing a variety of what is normal or what you normally see on your vaginal discharge. And then the other area where you will get a variation of the normal discharge will be on the sexual response cycle. If a woman is on the aroused state, usually you find that the other glands like the Nabothean glands will be hypersecretory, and also the Bartholin glands will be hypersecretory, meaning that there will be much more mucoid discharge, which will act as a lubricant around that event. Then medication also does alter normal discharge. If you are on contraceptives, the discharge tends to be a little bit more. If you are on antidepressants, it may be a little bit more dry. If you are using progesterone-only contraceptives, you find that it's a little bit more on the dry, and for other women, it's more on the wet side. So there are certain expectations around the certain classes of contraceptives that we are taking. So that was normal discharge and the variations thereof in what will be a normal discharge. Then the next topic that I would like to tackle is, when should I be concerned as a woman when it comes to a vaginal discharge? So I normally say that if there is a change from what you are used to, it is a cause for concern. Outside also the variations that I've mentioned above, that is a cause for concern. So there are certain factors that we consider, or certain factors that you should look out for. One, it is the color. If the discharge changes from the color that you know, then there is something that's not right. Some ladies will know that, one, if I'm about to start my periods, my discharge is going to be brown. Two, when I finish my periods, the discharge is going to be brown. Others will say, when I'm ovulation, I'm going to definitely have a spotting. So if there is a change outside of what you know, that is abnormal. Abnormal colors will be yellow, will be green, it will be pus-like. That is an abnormal vagina. Others will tell you of a gray discharge. That is abnormal. Smell, if the smell is like a rotten fish, dead rat, that is abnormal. The vaginal discharge, like I've said, it must smell clean. If it doesn't smell clean, it will smell like sour mass. That is a normal smell of the discharge. Then the other thing is consistency. If the discharge becomes lumpy, that is abnormal. If it becomes very thick or curdy, that is abnormal. If it becomes excessively mucoid with that abnormal color, that is abnormal. The other factor that I have included is sensitivity on your skin. Regardless of whether the color is normal, the consistency of the vaginal discharge is normal, the smell is normal. If it is irritating your skin, that is abnormal. That you may see on your panty liner or on the areas where the vaginal discharge touches your skin, that is an abnormality if your skin gets irritated. So having mentioned what can be concerning around the vaginal discharge, what are the common causes of an abnormal discharge? Like I've said, an abnormal discharge is observer dependent. Some people, when they are pregnant, or most people when they are pregnant, they will say that the order has changed. That is normally because pregnancy accentuates odors. So your partner is usually very instrumental in telling you whether there is a smell or not. And also, if you get to your healthcare practitioner, you can ask the healthcare practitioner to check the vaginal discharge if it is concerning. The other area that I've noted where people become very sensitive about their vaginal discharge is when they're in a new relationship. That I think there's something wrong with the discharge that may be, again, observer dependent. I always say that if you are concerned, please do speak to your healthcare professional. To me, as a healthcare professional, anytime a woman raises a concern, I don't take it lightly, because you spend a whole life in your body. You've got a better understanding of what happens in your body. Also, once you start having trust issues in your relationship, it's easier to pick up petty things. Sometimes they might be serious, alerting that there's something that's not right. Sometimes it's because you are in a very uncomfortable condition. So a condom always comes in very handy. Okay, number one, under the common causes of an abnormal discharge, I have identified medication. If you are on antibiotics, antibiotics can give you an offensive discharge. They can give you an imbalance between the germs that live in the vagina, thus resulting in change in consistency. Steroids have also been implicated in the change of the vaginal discharge. Contraceptives are implicated in the change of the vaginal discharge. I said abnormal because if you were not a person with a lot of discharge, all of a sudden you start on oral contraceptives and now your discharge is copious, you have to persistently shave because it's causing soiling of your pubic area or your vulval area, then that may be a cause for concern or a cause to change the type of contraceptives that you are on. Also, if you are on the progesterones, for an example, the injection, it tends to make you a little bit drier. So you can get hurt from using a toilet paper. You can get hurt just from inserting a tampon. You can get hurt from sexual intercourse because the skin is very thin and the protection of the lubrication from your body is not as effective if you are on the progesterone. The other factor can be things like breastfeeding. They do affect the type of vaginal discharge that we get. Okay, let's pass that. The second thing is disease conditions. Certain disease conditions will alter the vaginal discharge. An example would be cancer of the cervix. If one has got cancer of the cervix, the discharge can be bloody, it can be very offensive, it can be watery. All those are an alerting signal that there is something that is not right. Another disease condition is diabetes. In diabetes, the discharge tends to be more on the offensive side or more on the thrush, granular, itchy, burning sensation. So those are pointers that there is something that's not right in your general body. So a discharge actually can tell us also about what is happening in your body if we have not yet made the diagnosis. Autoimmune diseases like SLE, they can make the vaginal discharge very scanty, overall dryness of the mucous membranes, diseases like scleroderma, where you get very, very dry. The vaginal discharge is so scanty. There is tearing of the skin cannot stretch. So vaginal discharge, like I've said, it can assist us in making diagnosis of disease conditions actually involving other parts of the body. The fourth big group is infections. Infections, it can be sexually transmitted infections. It can just be infections from tripping of the balance that I spoke about of the vaginal environment. But vaginal bacteriosis, bacterial vaginosis, it's a bacterial infection. Actually, it's so amazing how much of a misnomer it is. It's supposed to be a vaginal bacteriosis, but it is called bacterial vaginosis, whereby now you get excessive colonization of the vagina by more bacteria compared to the fungus. That results in a fishy smell. So oftentimes we call it a sexually transmitted infection. I don't like to call it a sexually transmitted infection because even some women who are not sexually active or who have long been sexually active, they can have that condition purely from that imbalance. Other ones, it's chlamydia. Chlamydia tends to give a yellow pasty discharge. Same as gonorrhea. Gonorrhea can also be accompanied by passing urine with some pus either at the end or in the beginning of the stream. So those will give you yellow discharge. Candida will give you a mass-like discharge, or cottage cheese or feta cheese, whatever kind of a cheese, we can see that. And then trichomoniasis. Trichomoniasis is very, very offensive. This we are going to discuss in part B of our presentation on infections now. So this can alter the vaginal discharge. Number 5, I called unexpected physiological changes. Number 1 could be after giving birth. That could be due to the hormonal imbalance or due to the fact that you've given birth, your womb is adjusting, the placental bed is healing. That can result in an abnormal discharge. For the baby, it could be due to the estrogen withdrawal. So like I said, you get the vaginal discharge for the first 2 weeks after the child is born. Also with the baby, it could be secondary to nappy rash where the baby has thrush. That can also present as a vaginal discharge. Another unexpected physiological change will be around menstruation or on your menstrual cycle. When you are ovulation, it will be stretchy, clear, or it can be intensely white. That will be a discharge associated with ovulation. The start of menstruation, I said it can be brown. At the end of menstruation, it can be brown. Around ovulation, you can also get spotting, which will be just bright pink. So if you know that it is around that time, you will not panic. But anytime you panic, I always say, please panic towards your healthcare provider. It could be a midwife, it could be a general practitioner. Those people are very instrumental in helping us diffuse any fear or any concerns. Around pregnancy, there is a lot of discharge. Also, the odor varies according to how sensitive your smell sense has been heightened. Around menopause, the discharge can be irritating to the vaginal walls. It is very important that you see your healthcare provider to give you medication to deal with that. Another big group that I've included is lifestyle. Lifestyle can alter the vaginal discharge. In that big group, it would be douching. Most ladies believe that the vagina is a very dirty canal. It must be douched. That means that flushed with chemicals, flushed with betadine, flushed with intimate cleaners. Those oftentimes they trip the balance between the good germs and the bad germs. Hence, if a woman is persistently douching because of hygienic reasons, it is not a good practice. The vagina can be washed just with clean water, but there's always no need to go up. So let's wash only the vulva and not douche in the inside. Multiple partners also form part of a lifestyle. This can be objective or subjective. If you are involved in multiple partners, please know it is not an acceptable practice. It is not good for the health of the vaginal flora. If you are in a relationship where you are disputing trust, please use a condom for protection of yourself as a woman. So when you see that now this discharge is abnormal, what do you do? I said that please do seek counsel from your healthcare professional. What they normally do is that they will take a detailed history. So please don't be shy. You get to the healthcare practitioner, they start quizzing you, they ask you your practices, a number of partners, whether you douche or you don't douche, are you on a contraceptive or not. It's usually very intimate questions, which if you are not prepared, you may take them negatively. So please, let's prepare ourselves when we go to seek medical attention, that we will give history, and it is how much history or how much information you provide that is of assistance when it comes to your treatment. So treatment is usually empirical, meaning that there is standard treatment that is given. In medicine, we say common things happen commonly and they are treated in a common way. So if you go to see a healthcare professional about a discharge and it is offensive, you're most likely gonna be treated with treatment A. If you say it's itchy, you'll be treated with treatment B. If you say the color is what, you'll be given treatment C. So if you don't respond, then you may be escalated, sent to a specialist, or the sample of the vaginal discharge can be taken and sent for tests. Then from those tests, we will know what is specifically causing the discharge. Number two, why are you not responding to the usual treatment? If you are not responding, usually it's because we are treating the wrong cause, or we are using the wrong antibiotic. Actually, the kind of germs that are affecting you have changed codes. They are no longer sensitive to the kind of medication that we are using. So it is very much important that if you don't respond to treatment, don't change the practitioner, but go back to the same doctor to say that you have not responded. Because if you start moving from Dr. A to Dr. B to Dr. C, you will find that you still get one and the same treatment because that person is seeing you for the first time. Yet the first doctor has already had plan B, that if you don't respond, you're going to be treated with plan B. And then for those who have got an escalation structure, please don't be afraid to ask your GP. Don't be afraid to ask your nurse to say, I would like to be referred to the next level for treatment. So in summary, I am going to say that vaginal discharge is a normal phenomena in every woman of mature age. It's starting from puberty to menopause. If it happens through puberty, it is because there is either a withdrawal of estrogen from birth, or in some cases, if you find that the little girl is stealing the contraceptive, you can see an abnormal discharge from that. Otherwise, if there is a change in what you know, it is important to observe or seek medical advice. Number three, if there is a disease process that has been identified, please make sure that you start on treatment and you stick with the treatment. If there's no improvement, please don't change healthcare providers. Go back to the same healthcare provider and have treatment. If it calls for lifestyle change, please be willing to change lifestyle so that your vaginal atmosphere is kept at its best. Thank you very much, wonderful ladies. We are going to continue the next time and tackle the infection. Again, Ask Your Gynae is here to make sure that your medical needs as a woman are taken care of. God bless you.
Thank you so much, Dr. Gamete. What another informative session. You know, some of those things, especially around the discharges, sometimes you just don't know why. I mean, can you imagine like having a girl child, and you're seeing discharges on the child, and you're wondering how, I mean, what could be going, but she's answered that. She's made it very clear. So there are so many things that we have learned even from her session, and it will be important if you're anyone watching us, you're a woman, please kindly share this thing to your friends. It's important for us to know the things about our body so that we don't worry too much about the things we shouldn't, and then we pay attention. Attention to the things that require attention and need for us to go seek further help. So please share this with a friend out there, somebody out there, some friend, some family member would really be blessed by today's. A colleague, a sister will be blessed by today's. So help us. We've done the part of bringing it out to you. Yours, kindly help us share it. Amen.
All right, so we're going to end for tonight. Once again, thank you so much, Dr. Gamedze, for sharing your wisdom with us. I want to say to you, please subscribe to our channel,
yes.
Like our Facebook page if you're watching on Facebook or on YouTube, subscribe, and then hit that notification button so that you can get content that come up on our channel. I think we're done for tonight. We look forward to seeing you next Thursday for another exciting edition of the Amazing Power of a Woman broadcast. Good night.
God bless you.
God bless you.
Bye-bye.
Bye-bye.